Hello, everyone, and welcome to Amplified, the podcast where we explore how technology and artificial intelligence can amplify human potential. I'm your host, Ishant Majumdar, a high school student passionate about how AI can improve education, healthcare, and access to opportunity. Today, I'm joined by Dr. Arindam Ray, Assistant Professor of Information Systems at the Bryan School of Business and Economics at the University of North Carolina at Greensboro. Dr. Ray's research focuses on spatio-temporal data, machine learning, and AI for social good, with applications in public health, mobility analytics, and responsible decision making. Today, we'll be discussing how AI learns from data that changes across space and time, how it can be applied to environmental and health sensing, and what the future holds for spatio-temporal intelligence. Dr. Ray, thank you so much for joining me on Amplified.
Thank you for having me, Shant. Really glad to be talking to you.
Yeah, absolutely.
Because
Before we dive deeper, I'd love to start with some foundational ideas that will help frame the rest of our conversation. Dr. Ray, much of your research has revolved around spatio-temporal data. For our listeners who might be familiar with basic AI, how do you explain the difference between normal standard data and spatio-temporal data?
this is a great question, and I think it gets to the heart of why spatiotemporal data is important, right? So, if you think of the traditional data, you can think of it as a photograph or a snapshot. It gives
Hmm.
you kind of picture at one point of time and space, right? Whereas you can think of the spatiotemporal data as a movie, it gives you the whole story, right? So that's the primary difference. So think about it. Say, for example, you are watching a traffic intersection,
Okay.
right? You take a camera and you take a snapshot of that. Then you can find out that okay, at that particular point of time, how many vehicles were there in the intersection and things like that. But if you can actually look at a video of that intersection and also the nearby intersections, then you can decide on how the traffic flow is going, whether there is a congestion, is there a congestion moving from one place to another based on the time and all that. So that so the difference is, say for example, you are taking a decision based on one particular instant or one particular location, you might optimize the traffic flow based on that, and that might cause another bottleneck down the line, down the road.
Okay.
So this helps you in taking a decision, thinking about the system or the entire infrastructure as a whole rather than looking at one single point. So in short, adding the space and time allows your AI to stop treating every point of observation as an isolation, as a point in isolation, but as a connected dots into the entire
That gives a full
system. So
context of
that's
everything.
so that's the biggest difference between normal traditional view of it and the spatial temporal data.
Yeah, so the adding the dimensions like space and time is it's a huge game changer, is what you're saying, because you have so much more context, you have so much more like information to base your decisions off of. Is that right?
Definitely, yeah. That's the thing. That's the game changer, that you are adding that those context and
Yeah.
that.
But because it's so much more data, it's going to become harder for the AI to process, right? Why is this type of data so much harder to for AI to process than a static image or a block of text? What are the unique blind spots that traditional AI models have when they don't
Mhm.
account for timing or location?
So one of the way when you are talking about a block of text or kind of photograph or even other traditional table kind of a data structure, what you are seeing those as again independent points. So those are kind of interchangeable, and what you can do is take them as batch. What you do in a traditional machine learning models is basically you select a portion of that for training, and you do randomly select the rest of the portion for testing, right? You can't do that with spatiotemporal
Hmm.
data, right? Say, for example, you can't take a temporal data time which is happening in future or at a later point of time, training on that and then testing it on a item which has happened before,
Okay.
because that's not logical,
Yeah.
right? It's your earlier events might have some effect on your later events, so it's not interchangeable, so you have to think about that. Second thing is on the space side also. Like in a lot of traditional machine learning model, those spaces are kind of considered as just a categorical variable,
Mhm.
right? So if it is happening in one place versus other place, you just categorize this as two different places and all that. But there is a relationship between these places, how they are co-located, or if there is a pattern between them. Say, for example, if you have smoke or a wildfire in some locality, right? Then the localities which are downstream in terms of air, like air flow,
Yeah.
those are the localities which will get affected. It's not the same as something some locality which is upstream. So it's not only the proximity, it's also dependent on other variables, how these things are dependent, right? So you
Okay.
have to look into the context, and those gives some more insights into this. And then I think that's the context. And the
Mhm.
third thing is the scale of the data,
Yeah.
right? So when you add this time and when you add this space, it's you are looking at an explosion of data,
Absolutely.
right? So you need much more compute power to process those. So that's the third thing I would say about that. The hard it becomes much more complex and hard because of the scale of the data.
Absolutely. The funny story, when I first dealt with spatio-temporal data, it was climate data from things like the NASA's MODIS satellite and like I forgot the DayMat V4. And
Mhm.
I was new to this, so I decided to download everything locally onto my computer. And my computer, it I had to take it to repairs and everything, and it just it
Mhm.
wasn't working as well anymore.
So one of the project I was working, it had petabytes of data.
Oh,
So like obviously you can't do that.
yeah, yeah.
So I was using my university's clusters for working on those.
And earlier you were talking about context, right? This idea of context and how it's so important because it defines, this kind of data, the spatial
Mhm.
temporal data. How does a
Sure.
model distinguish between, these random spikes, data spikes, and like an actual meaningful trend in environmental or health sensing?
So these data are like you can't the context. I'll give you an example. Let me give you an example.
Mhm.
So say for example, if you are looking at a electrical grid,
Yeah.
right? And you see a spike, right? And the spike is maybe you are seeing that between the last half an hour to compared to this half an hour, there is a 50% spike of 50% usage. Now this happening at say at around 5:30 p.m. or 6 p.m. That might be an usual thing because people have got back home and
Mhm.
you are looking at a residential complex and you see that there is a spike from the previous half. If you see that spike at say 3 a.m. in the morning, then you can think there is something amiss, right? So that's the context we are looking at here, right? The time. So is there a pattern to it, or is this an anomaly,
Mhm.
right? So you can see this something in other places also. So suddenly you see one of the snack center near high school having a huge sale on a certain day. Now you might want to look at this, and in a traditional method you might want to say that okay, that this is an anomaly. You take that out of the question and then you do the rest of the processing. But it could be because there was a high school football match on that day and there was a reason for the spike, right? So you might have to look deeper into the data, that why those spikes are coming.
Okay.
It's those context you have to consider.
Okay.
I think that's the beauty of it when you consider this
Yeah, so,
time,
like,
space, and other related
a
events.
lot of in these contexts where humans apply, right, where humans are doing the activity, right, like they're turning on the lights or they're buying the snack, there can be a lot of these times where you can predict why these,
Mhm.
spikes are kind of there.
Right.
And in your experience, what are the biggest pitfalls when trying to use historical, environmental data to predict these future outcomes?
So okay, I can quickly remember a couple of points, and maybe I'll as I speak, I might remember a few
Hmm.
more. So first of all is non-stationarity of data. So basically, something happened in the past may not necessarily means that the things are changing,
Hmm.
right? And so things might be different compared to past to the future, right? So it's sometimes the past data doesn't tell the full story. Okay. And interestingly, sometimes your prediction itself can actually change the performance. Think about it. Say, for example, I'll give you an example of Google Map,
Hmm.
right? So you have a congestion on a highway.
Yeah.
Now the Google Map basically says that, okay, now this by lanes are, or the city internal roads are, you will go faster by that. Google
Wow.
Maps and go through that, then actually it might get more congested and you might take
Yeah.
more time. So this used to happen. I think now what they are currently doing is to avoid this. They do a distribution of the recommendation also in Google Maps so that you do not. So that's called kind of performative predictions where your prediction itself basically influences the outcome of the system.
That's
So that is
interesting.
one of the thing,
Yeah.
non-stationarity. The other thing is like your data bias or incompleteness. So sometimes historical data might not have a good representation from all the areas, and it's not just about spatio-temporal data. It can be in the traditional machine learning data also, that the historical data might not have complete representation from all the communities. So there could be a fairness or bias issues on those data,
Hmm.
right? Another thing is, so sometimes if you look at the data, it could be we are looking at just a correlation, and there could be a possibility, like when we are looking at it, these predictive models, and we kind of think about it as a causality, and that could be a false causality. You are looking at a correlation
Yeah.
and not a
Correlation versus,
causality.
yeah.
Causality. And I think in the spatio-temporal data, you at least can have some kind of a causality inference, but you have to be very careful about that. So if it is not causal, then you are not actually looking at the right kind of data set. And if things change on the causal side, then it might be different at a different point of time. And then the other thing is some of the events which you are looking at are, especially on the environment science or health, public health, these are like very high impact but very rare events, right?
Yeah.
Which Taleb says black swan events, right? So in those cases, you will have very little data about those events, right? You will have general 99% or even 99.99% of time those events do not occur, and only 0.1% or 0.01% time those occurs. And those were the time when you want to be anticipating those events. So that's another challenge of this. And maybe another thing we have to keep in mind is that these are probabilistic predictions, right? So you have to take that into context, and most probably you have to also keep your judgment over there, your domain knowledge, your expertise from there, to say that whether this prediction, how good or how bad this prediction is. Because, say, for example, in some cases, the medical X-ray detection system, if you see that X-ray and your inference and the AI inference are different,
Mm.
what do you think? What would you do? Sometimes what happens is you might have to look at whether to take AI assistance or you want to stick to your own decision. And then obviously even this has got different connotations. Say, for example, if you are taking a different decision and it goes wrong, then you might have to write a lot of reason why you did think
Hmm.
you took that decision. Whereas if you agree to AI's decision and it goes wrong, then you might have to just say that okay, AI also suggested this, so we I was doubly confident on that, right? But if when you are doing this implementation, the administration also have to think about this kind of a situation, and we should not penalize somebody who is looking into his skills and AI skills in conjunction and be independent, because otherwise you will see that everybody is believing whatever the AI is telling, and it's again a probabilistic distribution and it may not be correct on the time. So
And in a lot of cases, like medical too, it's like you said earlier, it's very important. And if if the decision goes wrong, who's held accountable for this thing if the model is
sure,
incorrect? But
that's true.
you know, in a lot of this context, it's prescribing the actionable solution. How do we move the AI from simply detecting a problem to
Mhm.
actually prescribing an actionable solution for city planners, policymakers, healthcare professionals, things like that?
So there are obviously like what we are talking about is from a predictive solution to a prescriptive solution, right? And I think there are obviously like if you look at the AI or the models, you have those prescriptive solutions coming up, right? A lot of cases it's kind of you do a simulation models where you can actually look at various scenarios and then look at what are the how the interventions will work and how that will look into how that will make the system outcome
Hmm.
of it, right?
Yeah.
Now the question is, in some of these simulations, it will be based on certain assumptions, right? So say for example, even in the COVID times, you have a lot of simulation models which kind of looked into how the infection will grow and how the hospitalization will grow and all that. Now all of this has to have some kind of assumptions on that, and then you would see that some of these graphs were not tracking and all that. Now question is how you balance it with some of the observed data, so your simulations are informed
Hmm.
by some of the data you observe, so it's much more closer to the real world,
Okay.
right? So that's the kind of balance you have to take. Now in some cases it will be late to decide on after you observe the data and then take a decision on that. It might be too late by that time.
No.
So sometimes you have to, it's again a business call, or depending on what situation are you in, you might have to make more assumptions and then less assumptions. So say for example, in my research on COVID, we could see that from people's movement till the hospital admission, we kind of have a 3 weeks gap. So that was enough. Like with the hospitals we were working in, they said, okay, if we get 2 weeks early notice about how much the hospitalization bed will be required, that will be enough for us. Then we said, okay, we can then go for a data-driven solution, right?
Okay.
Hospital.
And when you were working on this project on the hospitalization models, what mobility signals, actually were relevant, had meaningful predictive power, and then which ones were maybe just noise and not really helpful at all?
Very good question. I think, yeah, you are asking a really good question. So if you look at the mobility, right? So we were talking about COVID-19, right? It spreads by human to human contact, or even so if you are nearby to uninfected people, your infection can spread.
Mhm.
So it's given that if people move or go around moving around more, then it will spread more. Now question is what kind of mobility metrics we should consider on this. Now, one of the earliest kind of measure is like how much people are traveling in each
Yeah.
county. So if I take a unit of measurement of counties, so say for example, if some in some county people are moving more than some other county, it might be more risky in that county and it will spread more. But the question is, now look at the distance travel. Now, if I am traveling a long distance in my own car,
Mhm.
and there is nobody I'm in coming in contact with, then that's not an really a good measure for spread, right? So in our research, we actually took that as a one of the measures to see if that actually gives me some kind of an reason. But apart from that, we also considered number of locations visited. So
Okay.
average number of locations visited. So if you are going to 7 places and meeting people over there. So if you are going to different places, then your chances of meeting people are more, right? If you are driving, say, 50 miles and go to one single place
Mhm.
compared to you are driving 10 miles and going to 5 different grocery shops or different shops, then the chances of infection spread is more in the second case,
Mhm.
right? So so we created another feature or variable called number of locations visited, right?
Yeah.
The third thing we looked into is number of dense locations visited. Dense locations we defined is that at that point when this person is visiting, if there are more than say 10 or 15 people or whatever the threshold is, I think we consider 10 at that point. So 10 people in that area, then we call it as a dense location. And not surprisingly, this was the variable which actually
Yeah.
predicted the most, right? So that's one thing. Second thing is in another research paper where we were looking into the relationship of mobility. We were looking into which county to which county people are moving. And so there is a outward movement. So say, for example, when you are looking at, say, county A's possibility of trying to predict that their infection level on the next day or next period, we are looking at how many people from county A is going and visiting other counties and coming back. How many people are coming into county A. Say, for example, somebody is staying in county B and visits county A for work,
Yeah.
right? In that case, also there is a possibility of so all these interactions
Mhm.
between inter counties, and then and how infected are those counties, that determines how this infection will go up and down, right?
Yeah.
Um, it's when you have total isolation, then you can decide that okay, you can only see your county's data.
Mhm.
But when you don't have that, people are moving across the county boundaries. So if you are living in an island, most probably you don't need that.
Mhm.
But if you are not, then you need to consider those kind of connections, and typically you will look into a graph of those connections and see how those can be evaluated.
Yeah, yeah.
Okay.
So one of the biggest things is not just, how far, like a place could be very close to one place, but if nobody travels between them, you know,
Yeah.
the times, like the distance in terms of like infection is very far. But, let's take New York and LA, right? Places on
Mm.
completely separate sides of the country, but planes go all between all the time. So it's as if
Right.
they were right next to each other almost.
Right.
Yeah.
That's true.
And
That's true.
one thing though I was curious about is that when you're, tracking these people's movements, how do you balance, the predictive accuracy with concerns about, fairness and privacy? Because, like data privacy, you're tracking these people. How do you balance that?
So, okay, that's a very good question. Obviously, that's a concern everybody will have about their privacy when you are talking about this kind of data, right? So, in our research, actually, we are not interested in the individual data, right? So, we are looking at aggregated data. So, first of all, typically these data are anonymized, okay? But still, there are concerns that if you kind of track enough individuals. like one individual ID, though it is anonymized, you can track that ID, and then you can track and kind of gauge the individual.
Hmm.
But we were not interested in that kind of,
Okay.
right? We were looking into, say, for example, at a county level, if that county's number of hospitalization will go up, or say, for example, within one hospital in their area, what is predictive. So we were kind of looking at aggregated data, and so it's anonymized, and it's specially coarse data. It's coarse data. It's not a very granular data we were looking at,
Okay.
right? So from the modeling perspective, we were basically looking at the relationship between the mobility and the and the infection spread, rather than looking at individual level data, right? Then identities. So I think that way we can balance it. At sometimes, if you it's again, you have to look at what benefit we are getting and what kind of cost we are incurring for that. And so same thing for, say, for example, even in your any research you do, you go through a research approval process, even in clinical trials, when you are looking at medicines. So even in that field, you are looking at what are kind of benefits you are getting and what kind of risks you are taking, or the volunteers are taking.
Hmm.
And it's kind of looking at those risks and benefits, you kind of go ahead with the research. So there is a laid down process on this, which you should follow to make sure those, from the research perspective, that how do you ensure the privacy of the individuals
Yeah.
who are participating in your research.
Yeah. And like you said, this applies to, every single thing really dealing with data, right? It's always a
Yep.
concern. And is this a concern on any current projects you have, right? Is there anything you're currently doing right now where you have to think about that?
So, say for example, yeah, I am looking at some of the projects which are we are looking at mental health solutions. Um, I am looking more from an algorithmic perspective, that how do we enhance the solution, the interaction by the assistant, virtual assistant. But at the same time, we were kind of looking at not identifying the patients whose data we are looking at. So HIPAA prohibits that, right? So the company with whom we are collaborating, they are de-identifying the all those data and only giving us the script of conversation, right? So we do not have the data of which patient are using those. But the conversation itself is very valuable to us to look into how we can improve the conversation from the assistant side.
Okay. Okay. That makes sense. And, this is a project, of course, that's going on, and you're going to continue to do it. But specifically, going back a little bit, what is one area of, maybe spatio-temporal AI or just AI as a whole, that you
Mhm.
believe will surprise the world over the next 5 to 10 years?
I think the spatio-temporal side, environmental side, that the thing is, we are moving from the predictive or looking into the data to kind of looking into the anticipatory side of
Hmm.
it. So if you look into the spatio-temporal data, and we are kind of getting better and better on um, looking at something which is coming up, right? Say, for example, weather alerts. Think about even this winter storm, right? We are getting much more advanced about anticipating this and much more accurate on. Still a few more steps to go in terms of getting it right from the timing perspective and all that. But it's a lot of things which we can do right now with AI, right? So that's one of the area where we are looking into the anticipatory kind of way. And I think slowly the policies will be on that perspective. For example, environmental area, the traffic governance, and all these things, the governance will be more of risk informed, proactive governance. So those are the things which I would anticipate that will happen.
Okay. Okay.
AI will serve as more of a early warning. It will also serve as an early warning and a strategy tool, rather than just being a predictive kind of a tool.
Yeah. And I'm definitely seeing that a little bit too as well. For students, right? Is there anything you'd like to share with students, researchers, or practitioners who are interested in using AI, for environmental and human health challenges?
I think I don't just restrict it to the environmental or health challenges, but I would say that it will generally be applicable to other areas too.
Mm.
I think it will vastly benefit if you can think about how the system, in terms of system and incentive, right? So if you are looking at giving a solution, right? The solution is not in isolation, right? It affects the people. Its systems are shaped by human behavior. There are economic trade-offs. It's not an isolation, right? You get a nice technology solution, but it it will only work if these things fall in place. So that's the difference between, I think I would say that, from a you are listening from a information system professor who is in a business school compared to a computer science professor. So in a though I was an engineer by training in the undergraduate classes, and we are looking into the elegant solutions of a problem, right? But sometimes the elegant engineered solutions needs that context of economics and needs that context of business to make sure that it's actually used by the people. You need to learn that who gets benefited by using this solution and who pays the cost for it, and this entire context actually make you different from others, right?
Mhm.
So basically not only understanding the technology part of it, but understanding that context, that how it is going to use, what kind of changes you foresee after this, putting this into place. Say for example, like when the Uber came in, people like
Yeah.
taxi drivers kind of got displaced, right? So they will not be the people who will be willing to look into that. Now sometimes you do not foresee all the changes, right? So that when the Airbnbs came out, the hotels were kind of not looking at them as a threat, but they were still concerned. But then you could see that it actually raised, when you looked into the Airbnbs, people were thinking of, oh, okay, it's a pro people thing because that I can use my one spare room and I can earn some extra money. But at the same time, you can see that now people are in neighborhoods are protesting Airbnbs because it's actually increasing the rent in the area. People are not getting affordable rental properties, and so on and so forth. So there are consequences. So if you can think of more throughout that entire system, that view can be very useful. The second thing, another thing which is very useful, is how do you explain this to the people, right? So one thing is understanding it and then conveying it to the people, right? So not all the people will understand the technical beauty of the solution you are making,
Okay.
right?
Yeah.
Why it's the latest and greatest, and why do you want to use that, right? You have to explain it to in their terms, in simple terms, saying that what they understand, right? So getting that translation done to explain it to somebody who is may not be may not be as technologically strong as you, but at least translating it to in their language. So say for example, if they understand the economics of it, or say for example that's a business leader, they then you can talk about how that may increase the revenue, or building in the efficiency into the system so that you get the benefit. So translating into their language,
Yeah.
it definitely needs some experience, some practice, some. But if you can keep that in mind, if
Mhm.
the students can keep that in mind, that actually helps,
Yeah.
right,
Yeah.
to see that bigger
A lot
picture
of
and
these problems are at the intersection of two fields, and it requires the communication between them and having knowledge of both fields. These are wonderful insights. Dr. Ray, thank you so much for sharing your time, your insights, and your knowledge. This conversation really has highlights how much, how understanding patterns across space and time can help AI move beyond prediction and toward real world impact. Is there anything else you'd like to say before we end our session?
I think it was great discussing with you. I'm really hopeful for the future, seeing people like you taking interest and having so much engaging conversation with you. I think world is in good hands.
Thank you so much. To our listeners, thank you for tuning into Amplified. If you enjoyed this episode, please subscribe, share, and email me at ishamajumdar@gmail.com for any questions or potential episodes. Thank you so much for listening to our episodes, and see you later.
Thank you.